Assalamu alaikum students. Now in this presentation we will discuss the important joints of the foot, which will be discussed under these headings. That's the type, the articular surfaces, the ligaments, bursa, relation, blood supply, nerve supply and movements of the joint. Now the foot joints, the joints which are called as the foot joints, we have the intertarsal joints, that is the joints present between the tarsal bones, the tarsometatarsal joints, that is the joints between the tarsal bones and the metatarsals, intermetatarsal joints, that is the joints between the metatarsals, metatarsophalangeal joints, that is the joints between the metatarsals of the foot and the phalanges, and then we have the interphalangeal joints, that is the joints present between the phalanges. So there are a large number of joints, and majority of these joints, especially the joints of the forefoot, they are attached through large number of ligaments, and although there is large number of ligaments, but minimum movement is possible in some of these joints. Now coming to the important intertarsal joints, that is the joints which is present among the tarsal bones. Now you should be knowing the details of the tarsal bones. Now the most important joints is the joint which is formed between the talus, the calcaneum and the navicular bone, and again another joint which is present between the calcaneum and the cuboid. Now so we have the subtalar joint, that is the talocalcaneal joint. Subtalar joint is basically a joint which is formed between the talus and the calcaneum, and then we have the transverse tarsal joint, that is the joint formed between the calcaneocuboid and the it has two parts. One is the calcaneocuboid, that is between the calcaneum and cuboid, and other is the talonavicular part, which is the joint between the talus and the navicular bone. All together, these two parts, they are collectively known as the transverse tarsal joint. Now talking about the subtalar joint occurs where the talus, basically it is resting on the and articulating with the calcaneum posteriorly. So this whole large bone is the calcaneum, which is basically the heel bone, and the joint between this calcaneum, right, and the talus, it is known as the subtalar joint. And this part of the subtalar joint, that is between the talus and calcaneum, is also known as the anatomical subtalar joint. So here you can see again the articulation of the subtalar joint between the slightly concave posterior calcaneal articular surface of the talus. This is the concave articular surface of the talus, which is articulating with the convex posterior articular facet of the calcaneum. So this is the cavity of the subtalar joint. The articular surfaces, they are covered with the hyaline cartilage because it is a synovial joint of plain variety. So it has a joint cavity and has a capsule which encloses the joint and is attached to the margins of the articular areas of the bone. And then lining the capsule is the synovial membrane, and the ligaments which are supporting this subtalar joint, we have the medial and lateral talocalcaneal ligament, which strengthens the capsule, and then we have the introitious talocalcaneal ligament, which is strong and is the main bond of union between the two bones. And it basically, this introitious talocalcaneal ligament is attached above to the sulcus talli and below to the sulcus calcanei. Again you can see here, this is the medial talocalcaneal ligament and this is the posterior talocalcaneal ligament. Then we have talocalcaneo-navicular joint, which is a complicated synovial joint of ball and socket variety, formed by the undersurface of the head of the talus, articulating with the upper surface of the sustentaculum talli, body of the calcaneum and the spring ligament. Clear? You can see here, it is a ball and socket type of joint, the talocalcaneo-navicular joint, formed by the undersurface of the head of the talus, which articulates with the upper surface of the sustentaculum tali, and I hope you know what is the sustentaculum tali. It is a part of the calcaneum, and body of the calcaneum, and the spring ligament which is attached here, front of the head of the talus, which articulates with the navicular bone. This is the navicular bone. So we have already said that this talocalcaneonavicular joint is made up of two parts. Okay, one is the talonavicular part, which is formed by articulation between the head of the talus with the navicular bone, and then the talocalcaneal part of the talocalcaneonavicular, which is formed by the this under surface of the head of talus with the upper surface of the sustentaculum tali and the body of the calcaneum. Now, from surgical point of view, the point which is important here to understand is that the surgeons, especially the orthopedic surgeons, they take the subtalar term. They use the subtalar joint for the compound functions unit, consisting of the anatomical subtalar joint along with the talocalcaneal part of the talocalcaneonavicular joint. Now, we have already said that this anatomical subtalar joint, which is basically a joint formed between the talus and calcaneum, and we have the talocalcaneal part again, which is formed by the talus and calcaneum. But the difference between them is that this anatomical subtalar joint is involving the posterior part of the calcaneum and posterior part of the talus, whereas the talocalcaneal part of the talonavicular joint is involving the anterior surface of the talus and anterior surface of the calcaneum. But as talus is the main bone which is involved in both these joints, so none of the joint, although the subtalar joint is a separate joint having its own synovial cavity, having its own membrane and capsule, but it cannot move alone, because this talus is also articulating with the calcaneum anteriorly, forming the talocalcaneal part of the joint. So movement occur at this both these joints together, and together these joints, that is the anatomical subtalar joints and talocalcaneal part of the talonavicular joint, they are known as the clinical subtalar joint, and the movement which occurs around this clinical subtalar joint is the inversion and eversion which occurs at this oblique axis. And then we have the talonavicular part of the talocalcaneonavicular joint, which is basically a separate joint formed between the head of the talus and the navicular bone, and here in the same plane, in same transverse plane, we have another joint that is between the calcaneum, anterior part of the calcaneum, and the cuboid bone. So these two bones, that is the talonavicular part of the talocalcaneal joint and the calcaneocuboid joint, which are present along the same transverse plane, they are together known as the transverse tarsal joint, which is called the transverse tarsal joint. Now, basically what is happening at this transverse tarsal joint, that majority of the movement which is occurring at the midfoot and the forefoot. Okay, that the midfoot and the forefoot, they rotate as a unit on the hind foot. Okay, this is the hind foot, this is the midfoot, and this is the forefoot. So basically what is happening, that around this transverse plane, the midfoot and the forefoot, they are moving, or they rotate as a unit on the hind foot around a longitudinal axis. This is the axis of the transverse tarsal joint. This is the longitudinal axis, and again the movement occurring are the eversion and inversion. Basically the function of these transverse tarsal joint is that they augment the movement of inversion and eversion, which are basically occurring at the clinical subtalar joint. And due to the presence of this transverse, these two joints which are present along this transverse plane, so it is easy surgically, again it is easy to go for amputation along this axis, along this plane. So we have two types of plane. We have said that the clinical subtalar joint, which is comprising of the anatomical subtalar joint and the talocalcaneal part of the talocalcaneonavicular joint. Okay, around which the movements at this joint occur around the oblique axis. Then we have the talonavicular part of the talocalcaneal joint and the calcaneocuboid joint, which are both present along a transverse plane, and the axis of these two joints is the longitudinal axis, and the movements basically it helps to augment the inversion and eversion which is occurring around the subtalar joint. Now this is the calcaneocuboid which we are talking, which is a part of the transverse tarsal joints, and it is a synovial joint of plane variety formed between the anterior end of the calcaneum and the posterior surface of the cuboid. The articular surfaces, they are covered with hyaline cartilage, and joint is enclosed by a capsule. The synovial membrane lines the capsule. Again we can see that this is the calcaneocuboid joint, okay, and this is the talonavicular part of the talocalcaneonavicular joint. Both are present at transverse plane and though known as the transverse tarsal joints. And then we have the anatomical subtalar plane formed by the posterior aspect of the calcaneum and talus, and the talocalcaneal part of the talonavicular joint, which is formed on the by the anterior aspect of the talus and the calcaneum, and these are known, and that the subtalar joint and the talocalcaneal part of the talocalcaneonavicular joint is known as the surgical or clinical subtalar joint. Now we talk about the ligaments of the foot joint. As you can see, बहुत सारी bones हैं foot में, and they are linked together by large number of ligaments. जो इसमें important ligaments हैं जो कि main strength provide कर रहे हैं foot bones को, उसमें हमारे पास है plantar calcaneonavicular ligament, यानी कि plantar surface पे between calcaneum and navicular, इसको हम normally it is known as the spring ligament. Now this spring ligament, it fills a gap or wedge shaped gap between the talar shelf and the inferior margin of the posterior articular surface of the navicular bone, and it supports the head of the talus and plays an important role in the transfer of weight from the talus, and in also helps in maintaining the longitudinal arch of the foot. Then we have two types of plantar ligaments, long plantar ligament and short plantar ligament. The long plantar ligament, this one, it is passing from the plantar surface of the calcaneum to the groove present on the cuboid bone. Some of its fibers also extend to the bases of the metatarsals, okay, and where they form a tunnel for the passage of the tendon of the fibularis longus muscle. The long plantar ligament is important in maintaining the longitudinal arch of the foot. Then we have the short plantar ligament, which is also known as the plantar calcaneocuboid ligament. Now this ligament is located on a plane between the plantar calcaneonavicular and long plantar ligaments, ठीक है, दोनों के बीच में present होता है, extending from the anterior aspect of the inferior surface of the calcaneum to the inferior surface of the cuboid, and also involved in maintaining the longitudinal arch of the foot. Now talking about the movements of the foot joint, we have said that the major movement which is occurring at the intertarsal joint is the inversion and eversion, which is basically occurring at the subtalar and the transverse talar joints. And inversion is the movement of the foot so that the sole it faces medially, whereas eversion is the opposite movement of the foot so that the sole of the foot it faces in the lateral direction. The movement of inversion is more extensive as compared to the eversion, and both the inversion and inversion take place around the oblique axis, which I have shown you in the diagram at the subtalar joint. So this is the inversion in which the sole of the foot is facing medially towards each other, and this is the eversion, the sole of the foot faces outwards away from the opposite to each other. And as you can see, the inversion and eversion occurring at the subtalar joint, it occurs in the around the oblique axis. Then we have the tarsometatarsal joints, in which the first tarsometatarsal joint is a joint between the medial cuneiform bone and the base of the first metatarsal. So this is the first tarsometatarsal joint. It has a own capsule and synovial membrane. It is a synovial joint capable of some movements in a vertical plane and to augmenting the movements in the medial longitudinal arch of the foot. In some cases, for example in the flat foot, it becomes hyperextended, but the movement at this joint, that is the first tarsometatarsal joints, they are not comparable with the movement at the carpo-metacarpal joint, that is the first joint of the first metacarpal bone, that is joint formed by the thumb of the hand, and also the apposition, which is the one of the special feature of the thumb, is not possible in the big toe. Then the second tarsometatarsal joint, it is a somewhat immobile joint, and it is formed by the base of the second metatarsal. This is the second metatarsal bone, and you can see that this metatarsal bone is grasped on both sides, on the lateral and medial side, by this lateral cuneiform and the medial cuneiform, where the base is forming a joint with this middle cuneiform bone, or you can say the middle or the intermediate cuneiform bone. And you know, and the foot, in contrast to the hand, the plane of axis for the adduction and abduction, it passes from the second toe, whereas in the hand, the axis of movement for the adduction and abduction passes through the middle finger. That now the first metatarsophalangeal joint, that is the joint between the first metatarsal and the proximal phalanx, is very important clinically. There is a condition known as the hallux valgus, which is a lateral deviation of the great toe at the metatarsophalangeal joint. The incidence is greater in women than in men, and is associated with the badly fitting shoes. It is a foot deformity caused by the pressure either from the footwear which is not of your proper size, and some degenerative joint diseases characterized by the lateral deviation of the great toe. Sometimes the painful deviation is so large that the great toe, it overlaps the second toe, and there is a decrease in the medial longitudinal arch. And once the deformity has established, it is further worsened by the pull of the flexor hallucis longus and extensor hallucis longus muscles, which these are the tendons of the muscles which are attached on the big toe. So osteoarthritic changes occurs in the metatarsophalangeal joints, which then becomes stiff and painful. And when the joint becomes stiff and painful, then this hallux valgus is known as the hallux rigidus, that is joint becomes the rigid. And what happens that due to this pain and deformity, the head of the metatarsal, it is so swollen and inflamed that it moves out of the normal range of the this medial border of the foot, and on this bony prominence which is formed is known as the bunion. Now coming to the other joints, minor joints, which in which the ligaments play an important role and only limited movement are possible. We have the cuneo-navicular joint, that is the joint between the navicular bone with the posterior surface of the cuneiform bone, and the common capsule encloses the joint, and the ligaments which give strength to this joint are the dorsal and plantar cuneo-navicular ligaments. Little movement occur at this joint. Then we have the tarsometatarsal joint. Metatarsal joint, again the anterior tarsal bone articulating with the bases of the metatarsal bones, and these joints, they have separate joint capsules which encloses each joint. The ligaments which are present in this vicinity of this joint are the dorsal, plantar and interosseous tarsometatarsal ligaments, which bind the bones together. A slight gliding or sliding movement is possible at the tarsometatarsal joint. Then intermetatarsal, that is a joint present in between the among the metatarsals. These are the plain synovial joints in which the bases of the metatarsals, they articulate with each other, and the ligaments are in the dorsal, plantar and interosseous intermetatarsal ligaments, and little individual movements can occur. Now both these, in all these in intermetatarsals, metatarsophalangeals, interphalangeal joints, they have separate joint capsule which enclose each joint. The metatarsophalangeal joints, that is the joint between the metatarsals and the proximal phalanges, these are the condylite type of synovial joints in which the head of the metatarsals they articulate with the bases of the proximal phalanges, and collateral ligament support the capsule on each side. Plantar ligaments support the plantar part of the capsule. Now one difference between these here which you have to understand is that the up till this tarsal metatarsal joints, that is the joints of the midfoot and the forefoot, okay, midfoot and the hind foot, ठीक है. इनमें जो ligaments involved थे, these are the dorsal and plantar ligaments. We add in the forefoot joints, that is the metatarsophalangeal joints and interphalangeal joints involving the metatarsals and the phalanges, the collateral ligaments they are present, either the plantar collateral ligaments present on the plantar surface पे, and we have the collateral ligaments which are present which are supporting the joints. So metatarsophalangeal joints में we have the collateral ligaments, and the movements which are possible is the flexion, extension, and some abduction and adduction and circumflexion is possible. Then we have the interphalangeal joints. Interphalangeal joints are the hinge synovial joints in which the head of one phalanx articulates with the base of one distal to it. That is, these are the joints which are present between the phalanges. And again it has a separate joint cavity. The collateral and the plantar ligaments support the joints, and slight flexion and extension जो है वो it is possible in at these interphalangeal joints. Now coming to the clinicals, we have a condition which is known as the hammer toe. Hammer toe, basically it is a foot deformity in which the proximal phalanx, now you know that there are three phalanges, the proximal, middle, and the distal phalanx. Now in this hammer toe what is happening that the proximal phalanx is permanently and markedly dorsiflexed. There is a dorsiflexion of this proximal phalanx at the metatarsophalangeal joint. Okay, this is the metatarsophalangeal joint, and there is a dorsiflexion of the proximal phalanx, and the middle phalanx, this one is plantar flexed at the interphalangeal joint. Okay, and the distal phalanx may also be somewhat hyperextended. This gives the digit, usually the second digit is involved, and it gives this hammer like appearance and is known as the hammer toe. Then we have certain type of congenital abnormalities. One is the club foot. Now what happens in the club foot is that it is a foot that is twisted out of position. It is not present in a normal plane. And of the several types, the congenital types, they are important, which are present at birth, and it is known as the Talip's equinovarus, and the common type occurring 2 per 1,000 live births. And it basically this type of abnormality involves the subtalar joint. In this case the foot is inverted, the ankle is plantar flexed, and the forefoot is adducted, that is, it is turned towards the midline in an abnormal manner, as you can see here. Then we have the claw toes. Claw toes are characterized by hyperextension of the metatarsophalangeal joints and the flexion at the interphalangeal joints. That is, there is a hyperextension of the metatarsophalangeal joints and flexion at the interphalangeal joints, and the shape of the toes, they appear as claw shaped. So these are known as the claw toes. I hope you understand. If there is any difficulty, you can ask. Thank you.